Bronchitis story. A patient's journey with the doctor. The clinic visit. The patient entered the doctor's clinic while coughing severely, and his face was pale and his eyes were red from exhaustion. The doctor told him, "Hello, what brings you to the clinic today?" He answered while trying to suppress his cough. "Hello, doctor. For a week now I've been suffering from a persistent cough that doesn't stop, especially at night. It started as a regular cold, but developed into a dry cough, and now it's a cough accompanied by phlegm." The doctor asked him, "Are you experiencing other symptoms?" "Yes. I feel pain in my chest, especially when coughing, shortness of breath, and general fatigue. I also wake up at night due to coughing fits, and sometimes I feel a slight fever in the evening." "Okay. I will measure the pressure now," doctor said. "Now let me examine you first to see what's happening in your lungs." Doctor listened with his stethoscope to Ahmed's chest from the front and back. "Breathe well. I can hear clear wheezing and crackling in your lungs, and there's congestion in the bronchial tubes. Based on the symptoms you mentioned and the clinical examination, I believe you're suffering from bronchitis." He asked anxiously. "What exactly is bronchitis, doctor?" Doctor answered, "Bronchitis is inflammation in the tubes that carry air to your lungs, which are the bronchial tubes. When these tubes become inflamed, they swell and narrow, and begin to secrete excess mucus, which leads to persistent coughing." "And what causes this inflammation?" asked him. "The cause is often viruses such as those that cause colds or flu. Sometimes bacteria can be the cause, especially if symptoms persist for a long time. There are also irritating factors such as smoking, pollution, dust, or dry air that can increase the severity of the inflammation." Doctor sat behind his desk and began to explain the treatment plan. "Sir, the good news is that most cases of acute bronchitis improve within 1 to 2 weeks, and there are several ways to help alleviate symptoms and speed up recovery." Doctor wrote a prescription while explaining, "I'll prescribe a cough syrup that helps reduce coughing and facilitates phlegm expulsion. Also, a bronchodilator inhaler that helps improve breathing. And if you're suffering from fever, you can take paracetamol to reduce it." He asked, "Will I need antibiotics?" "In most cases, we don't need antibiotics because the cause is usually viral. But if symptoms persist for more than 2 weeks, or if the phlegm appears dark green or yellow, we may need to reassess." Then the doctor added, "There are also some home procedures that can help a lot. Drink plenty of warm fluids such as water, green tea, and soup. Inhale warm water vapor. Get adequate rest, especially in the first few days. Stay away from smoking and polluted places. Use a humidifier at home if the air is dry. And follow up after 1 week." After a week, he returned to doctor's clinic for follow-up. Doctor asked with a smile, "How are you today, sir?" He replied, "I feel much better, doctor. The cough is much less frequent, and the phlegm is lighter and easier to expel. I can sleep better now." The doctor added, "It's important that you continue the treatment until symptoms completely disappear, and even after that, continue drinking plenty of fluids for a few additional days." He asked, "Can the inflammation return again?" The doctor said, "Yes, the inflammation can return, especially if you have risk factors such as smoking or continuous exposure to pollutants." He said, "It's okay, doctor. Thank you very much. I will follow the advice and try to avoid people who have the infection. See you later." Pollutants.